Yes.
Looking back into like when you matched coming from Paraguay, what was that period of adjustment like? Many people listening are considering residence in the United States. I think that's one of the main reasons why people tune in and want to and are interested in the Meta-Analysis Academy is like coming to the United States is a strong motivation for that. And they want to hear from you. Like, what was it like coming from Paraguay and starting residency here? What was that transition like?
It was, I mean, of course, it was difficult adjusting to the system, Epic, language barrier. I mean, even though you feel comfortable, it's completely different. Like presenting the patients, it's really evidence based here in the U.S. That actually that was one of the reasons that I decided to come here. I learned more about that during the Harrington program, and then also like ICU was very challenging because basically we take care of, I mean, we during night, I was terrified about nights in ICU. And then, wait.
Yeah, it's tough. It's
Yeah, it's
tough.
tough.
That first year as an intern, as a resident, it's really busy, and there's also the period of adjustment for us as international medical graduates. So I started. I remember when I started off in like this rotation called transplant nephrology that we had in Jackson. And patients were sick. We were managing immunosuppression and checking prograph levels, and like I didn't know any of this. And you're an intern, and you're trying to learn the EPIC, which is the
Exactly.
electronic medical record. It's so tough in the beginning. And besides the workload, besides these challenges, I mean, was the workload surprising? Was it more than you expected? Was it less than you expected? Was it manageable? Just, knowing that it was a clinically oriented program where you did your residency.
It was manageable. I think that, I mean, during when I was an intern, we had a 10 patients cap.
Then, okay.
Yeah, so I think it was manageable. Of course, like getting used to Epic, it was very challenging. Putting the orders. I remember that in my first year, I put an order of vancomycin and I put the dose, I put the time and everything. And then my senior was like, no, it's pharmacy to dose. And I had no idea that it was pharmacy to dose vancomycin. So all of those things I didn't know, like how to put the orders. I think the Epic was very challenging. But then it was like we have 1 day off per week usually on the floors. And then if we go to an elective, we have weekends off, and clinic was great as well. And I think that I really like clinic because you have weekends off and you see your patients in the morning or in the afternoon. So I think that comparing to back home, I cannot complain. Like the workload is very manageable.
Yeah.
It's challenging, is away from home. It is language, and also you feel like you have to give your most, like for patients, you have to study. Like we have access to app today, so that's something that I try to do. Like while I manage this, I try to read and then study while I see the patients. So yeah, you're constantly learning. But the learning curve is very steep. Like without even you notice, you already managing and you learn so much. But at the beginning, it would take me forever, like to write my notes. I would stay longer to finish my notes.
Yeah.
Yeah.
Yeah. It's definitely a challenge, as you said, but also just a few months will go by, like 6 months go by in residency, and you're like a whole new person. You're like, how do I know how to do this?
Exactly.
You go to the ICU, same thing. You usually do 4 weeks in the ICU and a rotation, and then at the end, you're like you're know about the vent, and you know about ABGs, and you know about blood. Like it's you do procedures. So like the learning curve is very steep as a resident.